I am 76 years old. I have been practicing medicine for over 45 years, including nearly 3 decades in neurology and geriatrics in the Midwest. I have seen too many strokes. Some make it, some don't. There are patients I have sat and talked to one day. The next day they are lying still, mouths frozen, eyes wide open, and their families standing by with nothing to do but cry. That's what strokes are like. But that morning, I didn't expect to be so shocked when I picked up the newspaper and saw the bold words, "Pope Francis dies suddenly, cause stroke." I put the paper down, not because I was surprised by the death of an old man, but because even the Pope, with the best doctors, top-notch care, clean food, and healthy habits, still couldn't avoid a stroke. So, how many of us ordinary people can be confident that we are safe? The death of the Pope is not just a religious event. For me, it is a global wake-up call. And for older Americans, I know, there are millions of them sitting at home every morning, drinking a cup of coffee, reading the newspaper, and not knowing that a small blood clot can wipe out your memory, take away your ability to speak, paralyze you, or worse, collapse in your kitchen, as I have seen hundreds of times. I don't tell this story to scare anyone. I tell it because I believe you, if you're watching this video, still have time. And if you've ever felt dizzy for no apparent reason, if you've ever had a numb hand or mouth that went away, if you've ever felt disoriented or suddenly said the wrong word, don't take it lightly. I'll explain why. In this video, I will tell you why the death of Pope Francis is a costly wake-up call. Those at highest risk of stroke in the U.S., especially people over 60. Early signs that I missed. Deadly mistakes I have seen in patients and their families. And most importantly, small changes that reduce the risk of stroke by up to 80%, something I've implemented myself in retirement. If you find these things important, hit like so the video reaches those who need it most. Subscribe to the channel so you don't miss the next videos. And if you have had a stroke experience, leave a comment below. Your story could be the thing that helps someone else survive. Now then, let me begin. From the death of the Pope to the question, who among us will be next? I know many people will react like this. It's okay for the Pope to die. He was old. Yes, he was 87. But not all deaths at 87 are the same. He did not die of cancer. He did not die of heart failure. He did not pass away in the hospital after months of exhaustion. He died suddenly, just hours after receiving dignitaries in the Vatican. A stroke is like that. It doesn't need warning time. It doesn't ask if you're ready. It happens whenever blood flow to the brain is cut off, either because of a clot or a ruptured blood vessel. What bothered me was knowing that Pope Francis was still lucid a few hours before, and then no one expected that it would be the last time he stepped out of his room. That's why I want you, if you're sitting alone in your quiet kitchen, to really listen to what I'm about to say, because you still have a chance. Who is at highest risk? Let's look at ourselves. People over 60 years old, history of high blood pressure, taking diabetes medication, bad cholesterol, lack of exercise, and another factor, chronic stress. Do you recognize yourself in that? I know I did. And you know what? That's the health picture for 70% of seniors in America. What I want you to understand is this. Pope Francis, with a healthy diet, no smoking, no obesity, can still have a stroke because he is still in the high-risk age group and has a history of lung disease and takes long-term medications. If even you, someone with some of the best medical care on the planet, can't avoid it, then we, ordinary people, need to be even more careful. In the next section, I'll highlight the early signs, which are extremely easy to miss, but are key to survival if recognized early. Please don't look away from this video, because I promise it might help you, or someone you love, avoid ending up speechless, like Pope Francis. Early signs of stroke. What did the Pope experience before collapsing? As a geriatric neurologist, I have a rule. Never take any signal the brain sends for granted, especially when the patient is over 70 years old. Pope Francis showed signs of mild exhaustion in the days before his death, the Vatican said. He was still talking, receiving visitors, and walking on his own. But a dull headache, a slight weakness in his left shoulder, and a few moments of imbalance when standing were all noted in his internal work schedule. The problem is that, even to the most skilled medical team, these signs can easily be dismissed as age-related, and that's a mistake. Here are the common early signs I have seen in more than 100 stroke patients. Numbness on one side of the face, especially when smiling. Difficulty speaking, sudden slurred speech, even though a few minutes ago it was normal. Unable to raise both arms evenly, or one arm feels weaker. Disoriented for a few seconds. Blurred or double vision, especially in one eye. Sudden and severe headache with no known cause. Pope Francis is not alone in having these symptoms and not being able to react. I have treated ordinary people, mechanics, retired teachers, dry cleaners, and they all say the same thing when they wake up, if they survive. I thought it was just a sore shoulder or lack of sleep. That's the thing about strokes. You don't feel pain right away. You just feel something's wrong, and you wait. But the stroke doesn't wait for you. I always remind my loved ones to remember the keyword fast. F, face, asymmetrical face. A, arms, weak arms. S, speech, difficulty speaking. T, time, call an ambulance. Now, the Vatican announced that Pope Francis was rushed to the emergency room after his heart stopped beating. That means that once the stroke occurs, any medical intervention is too late. If you ever experience these signs, even for a few seconds, it's not a coincidence. It's your body's final warning. Remember, a lack of blood flow to the brain can kill millions of brain cells in just a few minutes. Every second of delay means a fraction of your memory, speech, and life. I'll go on to explain why strokes can still kill people in seconds, even when doctors are around, and what we, ordinary people, can do better to avoid making the same mistake as Pope Francis. Why, even with doctors by his side, did the Pope still not overcome? I want to make this clear, not to cause panic, but to clarify a cruel reality that I have witnessed hundreds of times in my career as a physician. Strokes spare no one, and having a doctor by your side does not guarantee survival. Pope Francis does not live alone. He has a medical team on duty 24/7. Someone takes his blood pressure every day, monitors his oxygen levels, checks his heart rate. He is not the type of elderly American who lives alone in a small apartment, with no one calling to check on him every day. So, what went wrong? Why did things keep failing? Let me be blunt. Because strokes often happen so quickly, and by the time the signs are obvious, it is too late. If Sir Francis had a stroke caused by a major hemorrhage or a blockage in a major blood vessel, the window of opportunity to save his life could be as short as minutes, and even a team of doctors would be powerless to do anything if the patient was not seen at the moment it started. Second, even as doctors, we can't see inside blood vessels without medical imaging equipment like CT or MRI, and many strokes don't have typical symptoms at first, just a loss of balance, a harsh remark, a slight misstep. You can't run to the emergency room every time, and that's why strokes are more dangerous than cancer. They don't give you a chance to come back. Things you, an ordinary person, can do better? You don't need a doctor around 24/7, but you should be prepared for the following. 1. Teach your family to recognize fast. If you live with a spouse or children, let them recognize the signs for you. If you live alone, print a reminder and hang it near your mirror or phone. 2. Have the easiest emergency number ready. No one in their right mind would ever dial 911 when their head is spinning. Save it to your speed dial. Put emergency in bold letters on your phone screen. 3. Monitor your blood pressure every day. A home blood pressure monitor is not just for show. Abnormally high blood pressure is a very early sign. Many of my patients have avoided their first stroke if they had taken it in time. 4. Do not disregard any small change in your body feelings. If you feel strange, call a doctor. Don't wait until morning. The Pope didn't wait until morning. You may not have the Pope's team of doctors, but you have something that many people don't have: time. And if you've made it this far, I know you're trying to protect yourself and the people you love. The silent lifestyle that leads to stroke, and lessons from Pope Francis. When someone like the Pope, who doesn't smoke, doesn't drink, eats well, and is cared for by a team of doctors, dies of a stroke, we have to ask ourselves, what about our lifestyle is more dangerous? As a doctor for over 40 years, I can tell you straight up, it's the seemingly harmless daily habits that accumulate the risk of stroke over the years. Pope Francis has a history of lung disease, surgery, and long-term medication. These factors cause chronic inflammation, one of the major causes of endothelial damage. The endothelium, the inner layer of the arteries, is easily damaged by high blood pressure, unstable blood sugar, even if not diabetic, bad fats in the blood, chronic stress, lack of exercise. Sound familiar? That's the average health profile of millions of seniors in the United States. We eat frozen foods, low in fiber, high in salt. We sit a lot, move little. We lose sleep, take sleeping pills, and then drink coffee laced with artificial sweeteners the next morning to stay awake. We call it normal behavior, but for me, it was pre-stroke behavior. So how do we break this chain before it's too late? I'm not calling for you to run 5 miles every morning or eat boiled vegetables for a week. I'm just suggesting practical changes that could save your life. 1. Cut back on salt. Everyone over 60 should consume less than 1,500 milligrams of sodium per day. Check frozen meals, canned soups, and salty snacks. They are invisible killers. 2. Replace white carbohydrates with whole grains. White bread, white pasta, cause a sudden spike in insulin, leading to vasculitis. Switch to oats, brown rice, whole wheat bread. 3. Add foods rich in magnesium and potassium. These two nutrients help control blood pressure and stabilize heart rate. Bananas, avocados, almonds, and spinach are good choices. 4. Drink plenty of water, but don't replace it with diet soda. Even zero-calorie sodas can damage the lining of your blood vessels if consumed daily. 5. Walk at least 20 minutes a day. No speed required, just regularity to keep your blood circulating and reduce the chance of blood clots. I am sure, if the Pope could return a week earlier, he would probably cut back on some of his receptions, go to bed earlier, have his blood clotting index checked. But no one knows, and we, the living, have to do the rest. How to get your family ready when a stroke comes. The last lesson from Pope Francis: strokes spare no one. Not just the elderly, not just those with underlying health conditions. They happen to the most powerful, the most knowledgeable, the most well cared for, like Pope Francis. The question I always asked myself after his death was, if he had been discovered just 5 minutes earlier, would the outcome have been different? You can't control every biological factor, but you can prepare. And not just for yourself, but for the people you love. 1. Families must be trained to recognize stroke. Print out the FAST rule and post it in a visible place in your home. F. Face. Face tilted when smiling. A. Arms. One arm is weak or numb. S. Speech. Unclear speech, mispronouncing words. T. Time. Call 911 immediately. There was no time to wait for improvement. Millions of brain cells died every minute. The Pope was not taken away when he started showing symptoms. He was taken when his heart stopped. That was the difference between life and death. 2. Always keep your phone near the bed, near the kitchen, near the bathroom. Most strokes happen early in the morning or when the person is in a private place. Make sure you can call 911 without having to go far. 3. Prepare a medication recall and brief medical history. When the paramedics arrive, they need to know what medications you are taking, if you have any allergies, and what underlying conditions you have. A printed sheet of information kept in your refrigerator, wallet, or next to your phone can save your life. Don't leave it to the doctor to guess at a life-or-death moment. 4. Talk to your children about an emergency plan. No need to turn your home into a hospital, but be sure, if you suddenly can't speak, who will call an ambulance? Who has a key to your house? Who knows your medical records? Pope Francis has a medical team, but not enough time. We don't have a personal doctor, but if we prepare, we can make it. Last words, from a 76-year-old doctor to you. I have seen over 1,000 strokes in my career. Some survived, some died within minutes. But I have never seen a case where the family did not say, "If only I had called sooner. If only we had known that was a stroke." I hope you are not the next person to say that. I hope you will. Hang the FAST rule at home. Measure blood pressure every morning. Walk 15 minutes a day. Eat less salt. And teach your children how to recognize a stroke as a survival skill. Don't think you'll be okay. The Pope didn't even get to say his last words. But if you're reading this, you still have time. Leave a comment if you have witnessed someone having a stroke. Share this video with your loved ones, because you can save a life without having to be a doctor. And if you find what I share meaningful, click subscribe so I can continue to accompany you in the next videos. We cannot stop death, but we can prevent it from coming too soon and too suddenly. I'm 76 years old, and I'm still learning how to protect others, one day at a time.